All right, hello everyone. My name is Dr. Adria Quigley, and I'm a first-year postdoc with the CTN, and I'll be discussing my postdoctoral study entitled Action for Positive Brain Health Now, Ready, Set, Go. I'm working with Drs. Marie-Josée Poyet and Nancy Mayo at the McGill University Health Center, Center for Outcomes Research and Evaluation. I have no conflict of interest to declare. So a little bit of a background. Approximately 50 to 69% of people living with HIV worldwide experience some form of cognitive impairment. As both the general population and people with HIV age, there's been considerable effort in the research to identify ways to age successfully. There's strong evidence indicating that non-pharmacological lifestyle changes can improve cognitive performance among HIV negative people. And the evidence is also indicating that many older people living with HIV could protect or improve their brain health through lifestyle change. Sustained lifestyle change is hard for everyone, but may be more challenging for those with a chronic condition that affects cognitive ability, which erodes the very executive functions needed for effective goal-directed behavior. So the key question is not whether interventions will actually help brain health in HIV, but how we can improve adherence to the most promising interventions. This study will test an innovative approach to enhance adherence to lifestyle interventions. The purpose of this study is to estimate the extent to which goal management training before a healthy lifestyle program is associated with adherence to health recommendations, achievement of health goals, brain health, and health outcomes compared to those who participate in the healthy lifestyle program alone. Goal management training is a cognitive rehabilitation program delivered over 9 sessions in small groups. It targets executive dysfunction and teaches self-management and mindfulness techniques. And it also trains participants to use explicit strategies to reduce cognitive load in their everyday tasks, as well as methods to cue attention to maintain focus on specific tasks. So the inclusion criteria will be Brain Health Now cohort participants who agreed to be contacted for sub-studies. They need to be 45 and older, HIV positive for at least a year, able to communicate English or French, able to give written consent, and have one or more indicators of cognitive frailty or not aging successfully, which we've defined as being above Canadian norms in less than 7 subscales of the SF-36. The exclusion criteria are dementia, life expectancy less than 3 years, or other personal factors limiting the ability to participate in follow-up, non-HIV related neurological disorders likely to affect cognition, known active CNS opportunistic infections, known psychiatric disorders, or current substance dependence or abuse in the last 12 months. We'll be using 2 digital applications as part of this study, the My Goals app and the My Health app. We are currently developing the My Goals app, which will help participants set goals and monitor their progress over the course of the study. The My Health app has already been developed and has been used with our collaborators in Italy, which will allow us to track our participants' health-related quality of life using weekly visual analog scale questions. We will be recruiting 50 participants per site from Vancouver and Montreal for a total of 100 participants. All of the participants who agree to enter the trial will be invited to attend the online Ready Set workshop, which will occur and will last approximately 4 hours. Participants will be given instructions on setting SMART goals and how to use our activity tracker, as well as how to use the My Health and My Goals app. We'll be using the My Health app to send questionnaires to the participants, and the questionnaire will be sent through the app every week, and the participants will have 48 hours to respond. The questions will include pain, anxiety, depression, sleep, distress, fatigue, and health perception using the visual analog scale. All the participants will be given a Garmin VivoFit 4 activity tracker, which will be worn on the wrist, and then they'll be trained on how to use it. And then the participants will be randomized to either goal management training or the healthy lifestyle program directly. The goal management training program will occur twice a week for 9 weeks. And then all the participants will enter the healthy lifestyle program, which includes social interaction and exercise, and that will last 52 weeks. As a result of the COVID-19 pandemic, this study is shifting to an online format. So the My Goals app is currently being developed, and this is just some screenshots of the templates that we're using thus far. Participants are asked to set 3 goals, as well as their corresponding actions, and then they're asked how to rate, how they would rate how difficult it would be to achieve each goal, as well as how important each goal is to them. So you can see the example with better sleep. We've also created a healthy lifestyle program manual to help guide participants in finding ways to achieve their goals. So for example, if a participant is interested in stopping smoking, we have links to smoking cessation apps as well as online resources. For all the participants, the healthy lifestyle program includes physical activity monitoring, including step count, calorie burns, and sleep using the Garmin VivoFit activity tracker. And the participants will be recording and monitoring their goals with the My Goals app. All participants will be offered an online exercise program with weaning to community-based resources and home exercise recommendations to encourage long-term sustainability. All participants will be assigned a healthy lifestyle program coach to facilitate the transition into community resources and to meet their goals. The healthy lifestyle program will include feedback, encouragement, and suggestions for increasing their physical activity using weekly interactions throughout the program. Physical activity target will be the current physical activity guidelines for older people, which is 150 minutes per week of moderate to vigorous exercise, which can be accumulated in bouts of at least 10 minutes. Meanwhile, the social activity target will be 1 social event per week. In terms of our outcomes, we have the confirmatory outcomes, which are physical activity weeks and social activity weeks. Physical activity weeks will be gathered using the activity tracker, and social activity weeks will be gathered by having the participants send photos of their social activities. For our explanatory outcomes, participants will be measuring using the My Goals app the number and diversity of their goals set and met. And then their physical activity will be measured using the activity tracker. And then their health states will be measured using the My Health app. And then for downstream health outcomes, we have 3 different measures of health-related quality of life, including the SF36, the EQ5D, and the PGI. And then cognitive ability will be measured using the BCAM, which is a computerized cognitive test developed by our team, as well as the C3Q, which is a self-reported cognition measure, also developed by our team. And then we'll also be measuring the Framingham CVD risk score, as well as social network size and quality. So the analysis assumes that the distribution of physical activity weeks at the end of the study will be approximately normal. So that will allow for a linear regression model. And we plan on conducting both intention to treat and per protocol analyses. Our sample size is approximately 100 participants with 50 participants per group to account for uncertainty in sample size assumptions as well as incomplete data. So the study is funded by a CIHR team grant under the Institute of Infection and Immunity, and I'm supported as a CTN Postdoctoral Fellow. And I'd just like to acknowledge the Brain Health Now team, in particular the team at the Montreal University Health Center.